I'm here with Tony Black and Sally Lee, who are involved in the project, the initiation of the infectious disease database, and they have been instrumental in bringing it to where it is today. And we hope that over time it's going to be more refined and will become more useful to faculty for QI purposes and for research. So the idea of this database was to create something that would capture all the clinical data that exists in the EMRs and make that accessible to us so that we can initiate observational research projects or QA projects, really whatever we want to do, and to really put the tool in the hands of the faculty. So instead of there having to be permissions to get any data, you'd be able to do this on your own time, on your own computers, wherever you are. You'll have access to this tool and then can use it to initiate ideas that you have in the course of seeing patients in the hospital. You know, we all have ideas about, you know, that's a really interesting case. What if there's 10 others like that in the university? Then I'd love to do something with that. And also we think it'll be very useful for fellows. A lot of fellows will get involved in research with their mentors. Sometimes that goes well, sometimes it doesn't. And if they have the ability to launch independent projects that may be smaller in scale, case reports, small series, observational research projects, then we want to make this accessible to them as well. So when we started the project, we had the idea to create a database that would exist within Amalga, which is a large data system that peers into all the data systems here at the university hospitals. So billing, labs, pathology, radiology, all of those systems stream in or can be viewed by Amalga. And when we were doing that, we quickly realized that it's tough to program that to meet the needs of each individual research project. Tony introduced me to this software package called I2B2. It's been renamed the DCDR De-Identified Clinical Data Repository. And that is basically a software tool that allows you to query Amalga in a de-identified way to determine the size of a cohort that meets whatever query elements you're interested in. So the idea of the project now has evolved so that all of us will have access to DCDR and can play with it to identify patients that are of particular interest to you. Once you identify that cohort, or the size of the cohort, and you determine that that's a good enough size for you to want to pursue the project, then you're going to want a data set on that cohort of individuals. So step 2, which we'll hear about today as well, is once your project has been approved and you've decided that it's worth pursuing, then a request will be made through Sally to actually get the data. You'll have to identify the data elements that you want: demographics, diagnoses, labs, vitals, meds, x-rays, pathology reports, whatever you need to accomplish your research project or QI project. You will give those data elements to Sally and she will pull those identified data right out of Amalga. Okay, so it's a 2-step process. The first one you need no permissions for. You can do it 24/7. Any idea that pops into your head, you can always log on from anywhere now that you have access to it. And this is just a cohort identification tool. And then once you land on a project or that it looks feasible to you and you want to pursue it further, then you're going to be asking for data. Okay, that's step 2, and that's going to have to come with some permissions. If you're wanting to do QI activities, then the data, you don't need an IRB application for that. However, the hospitals are going to want to know that you're initiating a QI project. So you'll send an email to me and to Sally, and when you want data for QI, you're also going to loop in someone else in your institution in the QI department. So if it's at Harborview, an email is going to go to Tim Dellett and to Patty Calver, and they'll look over the thing and say, this is a great idea. They're never going to say no, I think. And then you'll have permission to get the data. Sally will get the data for your QI project. If it's for research, then a couple of things will happen. The request will come in for data, and I'll review it. And one of the things I'd be asking for is I'd like to get just a small group of us to make up a committee that will determine whether or not the data request is reasonable for the project. The other thing to know is that there are monies associated with the project, and there is cost associated with the data pull. The cost will be influenced by how complicated the queries are. We have some data sets already created, or one data set that's already created that's fairly comprehensive. So if you want just the data elements that's in the already programmed data set, then there's very little programming time that Sally or Tony will have to do. So the cost for pulling that data set will be minimal. If you have a very complicated set of data that takes many hours of programming time, that's a more substantial cost. And so the purpose of the committee will be to say, that looks like a great project, that's worth the 5 or 10 hours of programming time that we'll have to pay for. And yes, go ahead and do it. Or that's not a very good idea, or you haven't thought it out very well, and why don't we give you some feedback about a better way to look at things that may shorten the programming time, and then take it on from there. So anyone who's interested in kind of serving on that committee, maybe people that have a lot of experience with observational data sets or doing research involving those data sets would be very helpful. So I think, again, today what we're going to learn about is the DCDR, and some of the tasks are pretty easy and straightforward, and some are a little bit more complicated, and Sally will walk us through that. The other nice thing is, once Sally and Tony have done the work to identify a data set or a query, it'll be added to a library of queries that you can also look at. So let's say that you have your particular project on Bordetella infections at the university, and you identify a bunch of cases and you determine what data elements you want to be pulled to describe that cohort. If those data elements already exist in a previously created query, then we don't need any new programming time, or maybe an hour or two to pull it up, but it's not going to be complicated or difficult. So in that case, there'll be essentially limited to no cost in generating that data set.
So I got involved in Bob's dream a couple of years ago, and we went through a couple grant cycles and got initial pilot funding from ITHS to get this started. Subsequent to that, I want to talk a little bit about ITHS's involvement and commitment to this. That was about $10,000 worth of funds to get it started, and we've probably doubled that now off the books, or tripled it actually, put another 2 times that much into it in terms of effort to bring it to this point, because it accomplishes and addresses a number of objectives and aims that we have. So we have an ongoing investment, we have an ongoing collaboration with the Allergy and Infectious Disease Division. This is about you folks. This is about giving you a tool to do research. That's the real goal. But I would be kidding you if I didn't say we don't have some other some other objectives. Broadly, the Biomedical Informatics group here is interested in promoting secondary use of electronic medical record data, and we've been doing that with people in this room, even, and a couple hundred other investigators for several years, and in a sort of custom fashion, quite successfully. This project is an attempt to systematize that and build a tool, build a higher level tool, and involve the investigator more directly. It's also specialty focused. Before, many of the things we did were general. What you'll get out of it is raw data. So we all know that, we all understand the process of having research coordinators and research nurses, comb through the chart and clean the data and enter it into forms and put it into a database. This is a different model. This is a model whereby informatics sort of leads the process, and you're able to go off and define the cohort and pull the raw data, but there is a step where data analysis and cleaning will have to take place later on. We just wanted to be clear about that. And so we are doing research, but we're clearly doing research on research here. Simultaneously, while we're training you and encouraging you to move through the entire cycle and do a study, we're going to be evaluating this, we'll be improving it, we'll be modifying it, and we'll be trying things again. To that end, Sally Lee has an IRB, a separate IRB, to do evaluation on this, which will involve one-on-one interviews with you and your experience of using the tool. So we need your involvement, we need your critique, and we need your patience, because this is not a finished software product. This is research on research. It's an experiment in the process.